You've seen I've had to use vinegar to treat this wound infection. We're short of everything. We're short on supplies, we're short on medication.
This British Palestinian doctor left his family in London and traveled to Gaza when Israel began bombing to volunteer as a surgeon.
On Saturday night, I realized that this war was going to be very vicious. Monday morning, I was in Gaza through the Rafah crossing. I've been to all of Gaza's wars, and I've been to other wars in Yemen and Iraq and Syria, so I have almost a 30-year experience in doing these kinds of missions.
Dr. Ghassan Abu Sitta is working in Gaza's biggest hospital, Al-Shifa. It's currently sheltering over 60,000 people. Some are injured, but the vast majority are seeking refuge from Israeli airstrikes.
It's kind of become a kind of tent city or a shanty city within the hospital. The hospital capacity is around 700, but there are now around 1,700 wounded, and the wounded are on mattresses in the corridors and on the floors and in the emergency department.
Israel has now accused Hamas of operating underneath Al-Shifa hospital, an accusation Hamas denies. Many are afraid Israel might target the hospital. Under international humanitarian law, it is illegal to target hospitals or other civilian facilities. But the World Health Organization has documented at least 82 attacks on healthcare facilities in Gaza since October 7th.
This is a massacre foretold, and unless the world intervenes, the massacre on a scale unknown before is about to happen.
At least 15 hospitals in Gaza have already closed due to fuel shortages. The Ministry of Health in Gaza has warned that the rest of the enclave's hospitals will follow suit soon.
Basically, without electricity, this hospital becomes a mass grave.
Israel has permitted a limited amount of aid to enter Gaza. Even before Israel's escalated attacks, Gaza's healthcare system was already on the brink of collapse.
So you can imagine a complete tsunami of wounded that's overwhelmed the system. And so the consumption of all of the material and all of the medication that is required to treat patients, all of these patients, has not been replenished.
According to the UN and human rights organizations like Amnesty International and Human Rights Watch, Israel has a history of targeting healthcare facilities. More than 100 healthcare workers have been killed since October 7th. Healthcare workers in Gaza are currently working overtime. Dr. Abu Sitta, for example, is barely leaving the operating room.
I'm absolutely exhausted and I cannot see an end to this.